Hello and welcome to Health Matters. I'll be your host today. My name is Dr. Michael Chillemi, where we're going to delve into essential health topics to keep you informed and prepared to take on any health challenge. In today's episode, we'll discuss a condition that affects millions of people worldwide, lower back pain. We'll talk about its symptoms, causes, diagnosis, treatment options, and the options could be ranging from non-invasive to medical interventions. We'll also highlight resources available at the Health and Spine Wellness Center to help you on your journey to a pain-free life. Okay, when we're talking about lower back pain, I'm gonna have to make this a series because there are too many topics to talk about. So let's unravel lower back pain, the symptoms, the causes, the diagnosis, and the treatment. This is going to be a nine-part series. Nine-part series, yes. Okay, we're going to talk about muscle and ligament sprain strains. We're going to talk about herniated disc conditions, bulges, ruptured discs, lumbar radiculopathy, sciatica, piriformis syndrome, spondylolisthesis, osteoporosis, and other skeletal irregularities like scoliosis. So let's understand a little bit about lower back pain. Lower back pain is one of the most common conditions in the world today. Nearly everyone at some point in their life will experience back pain, but only a few people will really experience severe back pain, debilitating back pain that if you've never had it, you can never understand the level of pain somebody can have from it. It's one of the most debilitating pains you can actually have. And I see it on a daily basis. I had a patient yesterday that basically was crawling into the office. And yes, they were walking out much, much better. But if you have never experienced the debilitating pain of low back pain, then you'll never understand what the level of pain can be. Now, I know when I was early on in my practice, I thought I understood what back pain was. But when you're young, you don't understand necessarily unless you experience some of it. So I have experienced it. So I do understand what it is. I do understand how to treat it and what the effects are. So with that said, back pain can be from as basic as some dull aching pain to constant severe pain that makes you have difficulty to move. So let's identify some of the symptoms of lower back pain. Dull aching sensations in the lower back, sharp pain that can go down the legs, limited ranges of motion in the flexibility in the back or the legs, pain that increases after sitting or standing, pain that improves when you recline back. Those are some of the common symptoms of lower back pain. You could have pain that radiates into your groin, down your leg, into your buttocks, all the way down the leg into your toes, from your big toe to your little toes, from your lower back all the way down into your calves. So the lower back really does control your whole lower extremity. So anything that's happening in your legs is directly happening from your back. If you affect the nerves in your lower back, you will affect your legs, meaning you'll have an impact on the ability for them to function. So for example, if you hit one of your nerves in your lower back, you can definitely affect your muscles, your nerves in your foot and leg. They are all connected. So it is really important to identify your symptoms For this podcast, I'm going to make this kind of a general overview because I'm going to do this as a 9-part series. It's just too much information to cover in one podcast. So I will be breaking it down. I'm going to go over some general concepts of what back pain is. And then in upcoming episodes, I will break down all those conditions from the herniated disc to the bulging disc to radiculopathy, sciatica, spondylolisthesis, crazy word, to any other condition that you could think about as far as with back pain. I'll really break it down for you so you can have a clear understanding of what it is and what the differences are. So, what are some of the common causes of lower back pain? Common causes can be as simple as muscles or ligaments straining and spraining. Lift up a heavy object and boom, now you can't move, your muscles twinge, your body will lock you up. That could be a muscle sprain strain. You could have conditions of bulging or ruptured disc, herniated discs. So discs act as the cushion in between the bones. So in between your bones is, we'll call it like a mattress, the mattress in between your bones. And that is the space that you need to take the pressure off your nerves. When you have a irritation or a disc bulge or herniation, part of that material can bulge out. And it can either bulge out, it can break off, it could do a lot of different things, and we will get into it at a later time. But ultimately, it could put pressure on your nerves, causing a lot of pain and symptomatology. Arthritis, osteoarthritis can affect your lower back. We just did check out one of my previous episodes on osteoarthritis. It can definitely cause pain and problems in your spine. One of the things it can do, which I will talk about in an upcoming episode, is spinal stenosis. Spinal stenosis, that's directly related with arthritis. When we talk about skeletal irregularities, we're talking about something like scoliosis. Most times people get it when they're adolescent and the body grows too fast and the spine buckles. Osteoporosis is another condition we're going to talk about. Osteoporosis is when your bones are weakened, and that can cause pain and pressure and even fractures. Osteoporosis is different than arthritis. And we will break it down, and I will explain the differences, and we will get into it. We'll get into the weeds, as they say on that. Spondylolisthesis. It's a condition where one of your vertebrae slips and actually either shifts forward or backwards. And that's going to change your dynamics of your spine, dynamics of where the nerves are and how they're affected. It could be one of the bones actually cracked, and that's what caused the slippage, or there's some other variations in there. And we'll get into the weeds with spondylolisthesis and all the different spondylos. There's a few of them, so we will get into it. Lumbar radiculopathy, typically characterized by lower back pain that radiates or goes down the leg due to a compression of a nerve. Similar, but a little bit different than sciatica. Sciatica is related to lumbar radiculopathy, but sciatica is specific that it hits the sciatic nerve, which goes from your lower back through your hips into your buttocks, down your leg. And I know a lot of people, when they have lower back pain with leg pain, the doctors or the patients themselves will say, oh, I have sciatica. Everything is sciatica, sciatica, sciatica. And it might not be sciatica. There's a few other conditions that do cause similar symptoms. And it is up to us, the physicians, to really define what is actually going on. Is it a lumbar radiculopathy? Is it sciatica? Is it piriformis syndrome? Piriformis syndrome is another syndrome we'll cover. And what that is there's a muscle in your gluteal region where the muscle's like this, your sciatic nerve is right underneath it like this. What can happen is as this muscle spasms down, it grabs down onto that nerve. It compresses that nerve a little bit, and that can mimic sciatica. So sometimes patients do have piriformis syndrome that is mimicking sciatica. And unless you understand the differences, you might just call it sciatica, and you're really never going to treat the correct problem. You can get numbness and tingling and weakness with piriformis syndrome. You can get it with sciatica, and you can get it with lumbar radiculopathy. So it is really critical to understand the differences of what those three are and how it can be affected. And we'll get into it. We'll get into it. Don't worry, we will. Diagnosing your lower back pain is critical into identifying how you're going to treat it, right? So everything starts with your diagnosis. The proper diagnosis is critical to find the underlying root cause of what's going on. And it is up to your professional, that whoever you see, whether it's me or somebody else, so they can get into the details of what's going on with you, how to get the best treatment for you, and how to do it safely, ethically, holistically, hopefully, or medically, whatever's needed. So getting a full medical history is the first step in understanding of what's going on, understanding the nature of the pain, where it's going. Doing a complete detailed physical examination is critical. Understanding your full ranges of motion, your muscle spasms, the ability for the body to move, what's causing more pain. Doing a full orthopedic exam. There are specific exams, they're called orthopedic exams, that can help determine what areas are affected, help clue you in on to whether you have sciatica, whether you have a muscle sprain strain, whether you have a radiculopathy. There are triggers in those examinations that will help determine what's happening. Other things that then we're going to want to look at is imaging. Starts with x-rays. X-rays, we're going to identify everything that's on. X-ray is bone related. So x-ray specifically is bone only. So I could see someone's bones, and I could see one bone here, and I could see the space in between. And I can guesstimate how much space that disc has, how much space that nerve has. But that's only a guesstimation, right? I really don't know what's happening with those nerves until I get the MRI, right? The MRI will determine if there's compression on the nerves, if there's bulges, if it's prolapsed, if it's protruded, whatever's going on with that nerve. The MRI is really the test to determine what kind of effects are on the nerve itself. It doesn't look at the bone per se so much. You still see the bones, but you're really focusing in on the soft tissue structure. CT scans are really looking for more bone problems. So step one is always x-rays, and then step two is usually MRIs. That's usually what we typically look for in determining what's going on with you and your case. Most times, I'll have identified what's going on with you by my examination and the history and how you're functioning. I would say a good 85 to 90% will determine what's happening based on that. The other information will be by imaging. And sometimes it is up to the examination to determine which, if I'm going to go straight into MRI, I have a hot disc that the patient has decreased in motion, decreased in function, you have loss of bowel control, I might get you right out for an MRI, because that's going to really determine what's going on. There are certain situations that you have to know what test to order and how fast to order them. Another study that we would want to see is an EMG NCV test, which is called a nerve study. And what that does is that checks the nerve signals from your back into your extremities. So remember I said your legs are controlled by the nerves in your back. So if you have a compression of one of your nerves and the compression is in your back, we can see it by the electrical signals of where the signals are, because we're going to test the nerve in different areas, and we're going to see how much signal we get. Kind of like if you had like an outlet, and you had a string of lights. Let's say you had a string of 10 lights for your holidays. Let's say it's your holiday lights, and one light is lighting up, but the other nine are not. Well, we're going to identify that there's a problem all the way on top by that first bulb that's out. Same thing that happens with your nerves. We'll identify what's going on. So if we have the first eight, let's say, lights are on, but the bottom two are not. Okay, now we've identified where the compression could be in your lower region, closer to where your legs are. So it could be affecting different parts. So it helps us really focus in on where your compression is. What are some of your treatments for lower back pain? Typically, treatments that we're going to want to do, we're going to always look for non-invasive, especially here in this office. We're non-invasive first. So chiropractic is always our first option. Spinal manipulations help alleviate pain, increase function, movement for the patients. We do not only manipulations, but we have a lot of different therapies that we utilize to help the muscles actually acclimate to movement, right? So typically, why do people get multiple adjustments? Just do a little quick side note. People get multiple adjustments because when we adjust or manipulate the spine, we realign the spine. But by doing that, your body is incredibly smart. It's so smart that it has muscle memory. The muscles remember where they are. And as you adjust the spine and you manipulate and put the segments back to where they go, your body's going to try to pull back based on that muscle memory. You have to come back multiple times because we're going to try to break that memory cycle of that muscle and keep everything aligned properly. Kind of like going to the gym, you have to build that muscle tolerance up and you have to change the muscles. Nothing happens 1, 2, 3 overnight. Everything does take a little bit of time. Just like going to the gym and getting muscles. No one goes to the gym today. Oh, I got muscles. Here I go. I went to the gym once. I'm perfect. Muscles don't grow that way. Muscles don't change that way. Your body doesn't change that way. I know people want instant results. In today's society, everybody wants it. 1, 2, 3, and they don't want to do anything for it. Unfortunately, the body just does not respond like that. Do patients get better incredibly fast? A lot of the times, yes, we could definitely get patients feeling better very, very quickly. But there is nothing that's going to go. I did one set of exercises. I'm done. I have muscles now. Look at me. I'm Arnold Schwarzenegger after one day in the gym. It just doesn't happen like that. I wish they had it. I wish I could be like that, but it just does not happen like that. Things do take time, and it takes repetitive sessions to actually make a change. Not a temporary change, more of a permanent change, right? So you could do stuff temporarily, quickly, and then things go back because as those muscles have memory, your memory cycles will kick in, and that's why the pain does come back. And you have to do it multiple times to make it more permanent change. Other things that we're going to look to do for non-invasive is physical therapy. We're going to want to have exercises that are tailored to stretch and strengthen your spine. The more you stretch and strengthen, the better you function. Your muscles in your legs and gluteal region they directly attach to the top of your pelvis. So as those muscles are tight, as your quads and your hamstrings are tight, your ability to move your hips and pelvis and your lower spine will be directly affected. So the more flexible you are, the better you'll feel, and B, the easier you'll move. And the easier you move, the easier you'll take the pressure off your spine. Other therapies we're going to want to do is we're going to want to do massage therapy. Massage therapy helps reduce muscle tension, promotes blood flow, and keeps the body moving. Hot and cold therapy. Typically, cold you're going to do when you have a 24 to 48 hours of a fresh injury. Otherwise, you'd want to use heat. helps increase the flow and movement of tissue. Stretching and strengthening exercises can help alleviate muscle strains, and tension by getting the muscles longer. Some of the medical treatments that people can do can be regenerative medicine, like PRP therapy. PRP is platelet-rich plasma. That can typically help heal the muscles by using your own body to heal it. We'll go into PRP on a later time, but PRP is meant to help heal a tissue from your own tissue. Pretty miraculous therapy and treatment that you can utilize for healing tissue. Other therapies that the medical community can use can be NSAIDs, whether it's, so Tylenol, ibuprofen, or whatever the case may be. Other treatments could be injections, cortisone, nerve blocks. We don't do those in this office here, but there are some medical communities that do that if you need it. Right? Everybody needs different things at different times. Everybody has to figure out what's best for them. There is a place for everything in medicine. Are there patients who need injections? Sometimes yes. And sometimes yes. You can't be naive to think there's one little box and everybody can fit into that box. There are outliers to each box that you have. And sometimes there are things that you need to do more for certain patients at certain times to get them in a better place faster. And sometimes, is it injections? It definitely can be. Is it surgery? Sometimes it absolutely is. There are cases that people do need surgery. And while obviously surgery is never the first option, right? It's always the last option because there's no going back. Once you're in, you can't go back. So we always tell patients, do everything in your power to do everything to avoid it. But at the end of the day, there are patients that need it. That's why it's there. That's why those doctors train for it, right? So if you need it, treatment is there, and it's there for a reason. Can't be so naive to think that one treatment's going to heal and correct every single possible condition. We can treat and heal a lot of conditions, but sometimes there are things that are outside of our scope and outside of where we are and what we can do. That's why there are others out there that can help and do great things as well. Together as a medical community, that's why we try to help patients, right? It's the practice of medicine. So we're going to practice trying to help everybody in their own individual way, because everybody's a little bit different, and what you need might be something different than what this patient needs. So it's critical for you to get to your providers, your medical community, to see somebody if you're having lower back pain. If you can't come here and see us, obviously we want to see everybody, as many people as we can. We love helping patients. Then definitely wherever you are, go see somebody. Get treated. Don't stay with back pain. You don't have to stay with it. In today's society, there are so many options out there for helping and healing it with wellness and holistic therapy. Go that route first. Things don't go where you need it. Get your second and third opinions, and then do anything you need to do to help heal you. So at the Health and Spine Wellness Center, we specialize in various non-invasive medical treatments. Our team of experts, chiropractors, physical therapists, medical community, all working together for the most effective, responsible pain management solutions for patients. In conclusion, lower back pain can be debilitating, but with the right diagnosis and treatment, you could achieve a pain-free life. If you're in the Belleville, New Jersey area, or within an hour or two of driving, come visit us. We'd love to see you. Or you can visit our website, healthspinewellness.com, and learn about these services that we offer. If you or anybody you know have low back pain, please pass this message along to them. Please subscribe to our channel. Please let them know there is help out there. I'm going to leave you with this, kind of what I always do. My opinion is the information you just received. Everything that I've told you is my opinion and my opinion alone. It is not meant to be medical advice. It is my opinion. If you are having a problem, you should go see your own professional to determine what's going on with you. This information is meant to be a learning experience for you to have information. Please utilize that as such, but go see somebody in the medical community, chiropractic community, the physical therapy community, the acupuncture community to help you. It is your life. You only get one of them. Be there healthy. Of course, health matters. Now remember, subscribe. I'm going to do this in a 9-part series. I'm going to get you all the information you need about different conditions. Stay well, be healthy. Till next time.